Targeted therapy in GI cancers has seen, I would say, rapid pace in terms of drug development, especially in the last decade or so. I will admit that we had a little bit of envy of the targeted therapy space in, say, lung cancer and breast cancer. I mean, obviously, breast cancer was such a pioneer in this field with the HER2 new targeted therapies. But I think in the last decade or so, we have seen a dramatic improvement in terms of understanding the relevant targets for all of the different GI malignancies, and then very successfully going after them with deliberate targets and or combination approaches. I think colon cancer obviously was really where we started this in terms of understanding KRAS mutations and the relevance of KRAS mutations in terms of EGFR targeting therapies. But then we've seen HER2 new targets in terms of gastric cancer, as well as colorectal cancer and biliary cancer. And then, my area of true interest in terms of research is biliary cancers. And we always talk about how biliary cancers in the last decade or so has really become a model for understanding how important the molecular landscape of a cancer is, and then understanding what the targetable alterations could be, and therefore developing drugs relevant to those targets. So it's been a slower start, I would say, compared to other solid tumors like lung cancer and breast cancer. But I think that we are seeing a significant upward slope in terms of drug development and understanding. And I do think that there's still so much work to be done. We still don't fully have a grasp on how we can better target pancreas cancer, for instance. We've made immense progress in the space of BRCA mutations for pancreatic cancer, and understanding DNA repair deficiency and that phenotype and how to go after it. But I think we've literally just kind of hit the tip of the iceberg when it comes to really understanding the complex interplay of signaling networks within GI malignancies as a whole, but especially in things like pancreas cancer, which I use as my example of an area where there's a lot of focus and emphasis for developing research.